video, we'll shortly go through the causes of malabsorption syndrome. So, first of all, coming on to the first cause, that is the pancreatic disorders. So, in this, either it can be chronic pancreatitis or it can be cystic fibrosis or malignancy of pancreas, also ulcerogenic tumors of pancreas such as the Zollinger-Ellison syndrome. All right. Then, secondly, it can occur because of the endocrine disorders or the defects, endocrine defects. So, in endocrine defects, what we have is carcinoid syndrome, Addison's disease, and diabetes mellitus. All right. Then third is a very important and confusing thing to remember, but I'll make it easier. So this is the third one is the disorders concerning deficiency of bile production of the bile acids and the bile salts. Okay, so to remember this, just remember an acronym as MADA. All right. So first by M, what you have to write is mucosal defects of absorption. In this, you can mention about tropical sprue, Whipple's disease, lymphoma, radiation enteritis. Then you can also mention about giardiasis, amyloidosis. All right. So by A next, remember there is a abnormal bacterial proliferation in small intestine. Now in this blind loop syndrome and hypomotility of intestine due to diabetes mellitus or stricture and fistula formation. All right. Then by I, remember interruption in enterohepatic circulation of bile, salts, and acid. This can occur in the parenchymal liver disease, also in the ileal resection. Okay. Now by D, remember there is going to be drugs that can cause the sequestration, such as neomycin and cholestyramine. Okay. Then by A, we have inadequate absorptive surface. So this is seen basically during the bypass surgery of intestine. All right. Then you can remember some fourth is the biochemical or genetic abnormalities. To remember this, remember the acronym is CHAD. CHAD is a young gentleman. So by C, what we have is celiac disease, hyper gamma globulinemia, a beta lipoproteinemia, disaccharide deficiency. Then remember through S. By S, you can remember the systemic diseases or specific malabsorptions, basically specific malabsorption. So, fifth one, such as lactose intolerance or lactose deficiency. Also, problem in vitamin B12 absorption, so malabsorption. This covers the causes of malabsorption syndrome.